Acute carpal tunnel syndrome, or ACTS, is a rare but urgent medical condition that can lead to permanent nerve damage if not recognized and treated quickly. Unlike the more common chronic form of carpal tunnel syndrome, which develops gradually, ACTS presents suddenly and progresses rapidly. This video explores a recent case series and literature review, highlighting the diverse causes, diagnostic challenges, and treatment strategies for ACTS. By examining real patient cases, we'll see why early recognition and intervention are crucial for optimal recovery and how ACTS is not limited to wrist fractures alone. Carpal tunnel syndrome, or CTS, is one of the most common nerve compression disorders, accounting for about 90% of all compressive neuropathies. It occurs when the median nerve, which runs through the wrist, becomes compressed. Chronic CTS is often linked to repetitive hand movements, vibrations, or underlying health conditions like diabetes. Symptoms include pain, numbness, tingling, and sometimes muscle weakness in the hand. Over time, chronic CTS can lead to muscle atrophy and loss of fine motor skills if left untreated. While chronic CTS develops over months or years, acute carpal tunnel syndrome is different. ACTS comes on suddenly, often after an injury or due to infection, and symptoms can worsen within hours. Patients experience severe pain, numbness, and sometimes loss of function in the hand. This rapid progression makes ACTS a medical emergency, requiring prompt diagnosis and intervention to prevent permanent nerve damage. Differentiating between acute and chronic forms is essential for timely and effective treatment. Acute carpal tunnel syndrome can arise from a variety of causes. While wrist fractures, especially distal radius fractures, are a leading cause, ACTS can also result from soft tissue injuries, infections, inflammatory conditions, or even medical interventions. In some cases, no obvious trauma is present, making diagnosis more challenging. Understanding the diverse causes of ACTS help clinicians maintain a high index of suspicion, especially when patients present with sudden hand symptoms. Our first case involves a 59-year-old man with diabetes and other health issues who developed ACTS following a flexor sheath infection in his hand. Despite initial treatment with antibiotics and surgery, he continued to experience pain. Imaging revealed signs of carpal tunnel entrapment. A second surgery for carpal tunnel decompression brought significant relief, and he recovered fully. This case highlights how infections, not just trauma, can trigger ACTS and the importance of repeated evaluation when symptoms persist. Second case features a 49-year-old woman who suffered a wrist injury without any fractures. Despite multiple assessments, her symptoms of swelling, numbness, and tingling persisted. An urgent CT scan ruled out a scaphoid fracture, but her clinical presentation suggested ACTS. She underwent carpal tunnel decompression under general anesthesia, leading to immediate improvement and complete recovery. This case demonstrates that ACTS can occur even in the absence of bone injury, emphasizing the need for careful clinical assessment. 62-year-old woman sustained a complex distal radius fracture after a fall. Initial treatment involved fracture reduction and casting. However, within 24 hours she developed severe median nerve symptoms. Surgery was performed to fix the fracture and decompress the carpal tunnel. Her symptoms improved rapidly after surgery, with full recovery by 3 months. This case illustrates how high-energy wrist fractures can quickly lead to ACTS, requiring urgent surgical intervention for the best outcome. In the fourth case, a 57-year-old woman with osteoporosis fell on ice, resulting in bilateral distal radius fractures. She was managed conservatively with casts. During follow-up, she reported persistent tingling in her left hand. A steroid injection provided partial relief, and she was scheduled for carpal tunnel decompression. This case highlights that ACTS can develop gradually and may require both conservative and surgical management, especially in patients with underlying risk factors. 65-year-old man, active in his profession, suffered a comminuted distal radius fracture. Initially treated with casting, he later required surgical fixation due to fracture displacement. After surgery, he developed altered sensation in his hand, raising suspicion for ACTS. Carpal tunnel decompression was performed, resulting in significant improvement in grip strength and finger function. Although a minor sensory deficit remained, he was able to return to work. This case underscores the importance of monitoring for ACTS after wrist surgery. Sixth case involves a 43-year-old man who sustained a minimally displaced scaphoid fracture after a car accident. Initially managed with a cast, he later developed numbness and tingling in the median nerve distribution. Imaging showed incomplete healing, prompting surgical fixation and carpal tunnel decompression. The procedure was successful, and his symptoms fully resolved by 3 months. This case shows that even minor carpal bone injuries can lead to ACTS, highlighting the need for vigilance during follow-up. Viewing the clinical summary, we see that ACTS affected both men and women, aged 43 to 65, with diverse medical backgrounds. Causes range from infections and soft tissue injuries to various types of wrist and scaphoid fractures. Management included early surgical decompression, steroid injections, and conservative care. Outcomes varied, with most patients achieving excellent recovery, though some experienced lingering sensory symptoms. This diversity underscores the complexity of ACTS and the need for individualized treatment. CTS is a rare condition, with an estimated incidence of just 1.4 new cases per 100,000 people per year in the studied population. This rarity makes it challenging to study and highlights the importance of case series and literature reviews. The British Orthopaedic Association reported a much higher incidence for all CTS cases, emphasizing that acute presentations are uncommon. More research is needed to better understand the true incidence and risk factors for ACTS. Timely surgical decompression is widely recognized as the key to successful outcomes in ACTS. Patients who underwent surgery within 48 hours of symptom onset typically experienced rapid and complete recovery. Delayed intervention, especially beyond 3 days, was associated with persistent symptoms, though improvement was still possible over time. These findings support the consensus that early action is crucial to prevent long-term nerve damage and optimize patient outcome. Acute carpal tunnel decompression presents unique challenges compared to elective procedures. Patients with ACS often require general anesthesia due to severe pain and difficulty positioning the hand. Elevated pressures in the carpal tunnel can alter anatomy, making surgery more complex and increasing the risk of residual symptoms. Surgeons must carefully plan and discuss these risks with patients before proceeding. Awareness of these differences is essential for optimal care. Still radius fractures, especially those classified as AO-OTA type C, are the most common cause of ACS. High-energy trauma, open fractures, and surgical fixation increase the risk. Postoperative swelling, hematoma, and biomechanical changes can all contribute to median nerve compression. Vigilant monitoring is essential for patients with these injuries, as early detection and intervention can prevent long-term disability. Scaphoid fractures are the most common carpal bone fractures and can also lead to ACS. The scaphoid forms part of the radial border of the carpal tunnel, and injuries here can directly impact the structures within the tunnel. Both acute and delayed ACS have been reported following scaphoid fractures. Early neurovascular assessment is critical to ensure timely intervention and avoid permanent nerve damage. Imaging studies, such as X-rays and CT scans, play a vital role in diagnosing ACS and its underlying causes. They help identify fractures, soft tissue injuries, and anatomical changes like interior bowing of the flexor retinaculum. However, clinical assessment remains paramount, as ACS can occur even when imaging is inconclusive. Combining imaging with thorough clinical evaluation ensures accurate diagnosis and timely treatment. Mainstay of ACTS treatment is urgent surgical decompression of the carpal tunnel. In some cases, steroid injections or conservative management may be considered, especially for milder or gradually developing symptoms. The choice of treatment depends on the cause, severity, and progression of symptoms. Early intervention is consistently associated with better outcomes, while delays can result in persistent nerve dysfunction. Outcomes for ACS patients vary depending on the timing of intervention and underlying cause. Most patients in the case series experienced full or near-full recovery, especially when treated promptly. Some, however, had lingering sensory symptoms or minor deficits. These results highlight the importance of early recognition, individualized treatment, and close follow-up to ensure the best possible recovery for each patient. Healthcare providers, ACTS requires a high degree of clinical suspicion, especially in patients with recent wrist injuries or infections. Early diagnosis and prompt surgical intervention are essential to prevent permanent disability. Clinicians should be aware of the diverse causes and presentations of ACS, and maintain vigilance during follow-up of high-risk patients. Ongoing research and updated guidelines will help improve outcomes for this rare but serious condition. Summary: acute carpal tunnel syndrome is a rare but potentially disabling condition that extends beyond wrist fractures. Its diverse causes and presentations make diagnosis challenging, but early recognition and intervention are key to preventing long-term dysfunction. Continued research, clinical awareness, and guideline development are needed to optimize care for ACS patients. By learning from real-world cases, clinicians can improve their ability to identify and manage this urgent condition, ensuring better outcomes for those affected.